Nadia can start recording. Okay, so if
Mhm.
you joined us our research seminar in I think July, so Dr. Sharifah already delivered a talk on
Mhm.
question and validations, but I
Mhm.
will introduce again here. If you about our speaker, Dr. Sharifah Maisara is obtained a degree in psychology, Master of Clinical Psychology, and PhD in Health. Her area of specialization is clinical psychology with a field of interest in cognitive rehabilitation, cognitive neuroscience, and mental health. Dr. Sharifah is currently a senior lecturer from Department of Educational Psychology and Counseling, Faculty of Education since May this year. She actively involved in research related to community recovery at UM and intervention related to social issues and cognitive function and psychological well-being among cancer patients. So Dr. Sharifah is actually our former PhD student in Department of Surgery. So I think
Yes.
she can start now. The floor
All
is
right.
yours.
Okay, thank you very much, Dr. Hamiza. Okay, Assalamualaikum and a very good afternoon to Dr. Hamiza. And oh, hopefully later on we will be having our students to join us shortly. All right, without further delay, let us proceed with this discussion on. Let me share first. Okay. All right, so this is the topic that I am going to share with all of you, a surgeon's guide, drafting a manuscript, right? So let me make it as a slideshow. All right, so those are among the components in which we are going to look at for today's discussion. We will have those introduction, getting started, things to do before you write a word. What are the main sections of a scientific article? We will go through briefly on what is introduction section, methods section, results, discussion, what you should include in your abstract title, and not to forget we will have our references. Okay, so let's have a look together on the introduction. So so here we go. All right. So basically, in general, a researcher, when they write a paper or a manuscript, definitely they would like to publish their work, right? And of course, when they write a paper for publication, most of the time it will be something related to their area of interest, or we can say that area of expertise. But when it comes to student, the purpose of writing a paper will always be to provide an excellent learning experience, to promote critical thinking, and also to enhance the ability to be more concise in writing communications. And as for all of you, I believe all of you are medical doctors, future surgeons, I believe, and also young researchers, like me. So when we write, and eventually publish, scientific papers, we are trying to fulfill maybe one or all of the objectives on these slides. So the objectives that we are trying to fulfill when we write scientific articles would be, we want to share the clinical as well as research observations that we make, submit one's observations, ideas, and conclusions to critical evaluation by peers, provide guidance, especially when it comes to improve the health care of children. We can have youth as well as adults in our country. And finally, to advocate for policy change. So this policy change, it depends very much on our field. So when it comes to my field, I have my own policy. We have a mental health policy for clinical psychologists. For mental health. So perhaps in my field, when I conduct research, I would like to aim for changing this mental health policy. right? So yeah, we are here. So when it comes to planning to write, and eventually publish, your work, before you start writing, hopefully you will be able to answer those questions. What do you want to say about the topic? So what is your key message? Why do you care about this particular topic? Yeah, who is the intended audience? Is whether maybe it can be the one in your field, or maybe it's just that the society as a whole. Yeah, it depends very much on who is your target audience. You might want to also answer why would this audience be interested. Who might want to work on this paper with you. Is it the one your colleges, maybe your someone in other disciplines. You might want to invite somebody from other disciplines, possible as well. And what format as well as type of journal should this piece be submitted to? And we are going to answer all the questions in the next slides. All right, so getting started, things to do before you write a word. Okay, so when it comes to getting started, or things to do before you write a word, it refers to the background, or preparatory stage of work. So at this particular stage, you should already perform an extensive literature review. In this case, you might need to read a lot. And why you need to have this extensive literature review? It is because it's very important for you to establish the current state of knowledge on the topic. And finally, before you ensure the originality of your research, of course, you are trying to fill in the gap. And finally, you are going to ensure the originality of your research. So before starting to write, it is very important for you to identify the target journal in which you intend to submit your research. So when it comes to identifying the target journal, it means that whether you want to submit your paper to maybe specific journal, or perhaps to a general journal. Don't worry, I will explain in the next slide what does it mean by specific journal and what does it mean by general journal. But above all, when you identify the target journal, you are actually trying to fulfill that orientation of your writing style. That's where you right away you'll be able to format your paper, and finally you'll be able to identify or recognize the type of reader you are targeting. Now we are here when it comes to specialist journal or general journal in your field. So this specialist journal, it is where readers are expected to be experts in your field. For example, an example of specialist journal, we can have this World Neurosurgery journal. The publisher is, if I'm mistaken, Elsevier. You can see that the EIC, editor-in-chief, is also a neurosurgeon. And you can see that the papers in that in that journal are actually related to patients under the neurosurgery. So that would be specialist journal. And we can also have the general medicine journal. For example, let's take this example in which I have published before. We have this supportive care in cancer. So this journal, supportive care in cancer, anyone, in the field of medicine, for example, we can have oncologists, you can have the breast surgeon, you can have the clinical psychologist, clinical neuropsychologist, can submit their work at this general medicine journal, where readers may be experts, yeah, from other disciplines. This is very important. Yeah, you need to identify, yeah, whether you want to submit your work to specialist journal or general journal. Yeah, this is because, yeah, you need to know, yeah, you need to what do you call that, identify, yeah, the amount and type of information that you might or that you must include, yeah, in your write-up. Yeah, some journals, yeah, as you can see, yeah, some journals, yeah, favor papers reporting basic research, whereas other journals give precedence to more clinical work. So this basic research, for example, yeah, you might want to conduct some cross-sectional research study. Yeah, is when you just administer, yeah, a questionnaire, yeah, and clinical work, yeah, I believe it is more familiar to your field, yeah, in which you can have the RCT, yeah, you might want to use some imaging techniques, yeah, so I believe that refers to the clinical work. Yeah, all right, so what are the main sections of a scientific article? So when it comes to these main sections, yeah, of a scientific article, the vast majority, yeah, of a scientific journals out there, yeah, will follow, yeah, those what do you call that, acronyms that I have over here in on our slide. Yeah, we have IMRAD, yeah, we have introduction, yeah, methods, results, as well as discussion. Yeah, now let us have a look together what you need to have under your introduction section. Before we move on what we have under introduction section, then let's have a look together what is it all about. Yeah, this introduction section, yeah, requires you, yeah, to explain briefly, yeah, using appropriate references. So in this section, yeah, you need to tell, yeah, or you need to share, yeah, with the readers what is already known about this subject. Yeah, identify the areas where there is still some uncertainty or any previous and possible conflicting data. You might want to describe, yeah, the gap in the knowledge that your study aimed to fulfill, yeah, and eventually you need to clearly state your working hypothesis, yeah, followed by your objectives and the strategy implemented to achieve these goals. Yeah, very briefly. So basically, this introduction section is very important because you are actually trying to sell your work or your research. Yeah, all right. So in the next two slides, yeah, I will share with you, yeah, what you should include, yeah, in your introduction section, and also, yeah, suggestion for tense to use, yeah, when you write your introduction section. So as I've mentioned earlier, yeah, we have your background, yeah, under your introduction section, yeah, describing what is known on the subject, yeah, and you need to also include what is not known, yeah, what elements are still subject to controversy, what is the exact gap, yeah, cite any existing data, yeah, especially conflicting data that indicate uncertainty. For examples, you can have that, yeah, you might want to mention, yeah, it remains unknown whether or maybe to date, yeah, it has not been proven, you know, or maybe there are few data to quantify, and so forth. Yeah, and you also need to have, yeah, your objective or your working hypothesis, yeah, in which you might want to have, yeah, that particular sentence or statement, yeah, in which we hypothesize that, yeah, the administration of perhaps certain drugs or intervention, yeah, and so forth, would reduce or perhaps increase, yeah, in the context of what, yeah, and finally cite, yeah, the exact parameter, yeah, you plan to measure. Yeah, maybe you can have that a particular sentence. Yeah, we aim to identify, or maybe we aim to evaluate this and that. Yeah, so that would be among the features, yeah, important features that you might need to include in your introduction section. So this would be the tense, yeah, that you might take into account, yeah, when writing your introduction section. So when you want to describe, yeah, the current state of knowledge, of course you need to have, yeah, you need to use the present tense. Yeah, and maybe when it comes to, yeah, let's take example number 3, yeah, to describe, yeah, aim number 3, to describe a process, yeah, that began at some unspecified time in the past and is not yet complete. That's where you might want to use, yeah, a present perfect tense, yeah. And maybe when it comes to the final aim, yeah, to formulate your objective, definitely you need to use past tense, yeah, in which, for example, yeah, you might want to have we aim to measure or we aim to examine, yeah, and so forth. Yeah, so that would be the tense that you might want to take into account, yeah, when it comes to completing your introduction section. Now let's move on to what we have under methods section. So as we all know, this methods section describe, yeah, exactly what you did and how in sufficient detail, so that at the end of the day, yeah, any average reader with the same resources at their disposal would be able to reproduce or replicate, we call it as a replicate, yeah, your study. Yeah, that's very important. Yeah, it means that you need to have as much detail as possible under this method section. Yeah, so what you need to include under this method section, yeah, would be, yeah, you need to specify, yeah, the design of the study. If it is a prospective study, you need to mention that it is a prospective study. If it is a randomized or non-randomized, yeah, double-blind and so on and so forth, you need to specify it under the design of the study. And also, yeah, you need to describe, yeah, of whom or what you studied. Yeah, it means that it refers to the study population. Yeah, it refers to your participants. Yeah, or maybe your animals. Yeah, maybe in your area. Yeah, you might want to use some cells. Yeah, and under this, yeah, description of whom or what you studied, if you use participants, yeah, you might also, for example, inform how do you get to that number, yeah, of participants. Yeah, perhaps you might use some softwares, for example, in order to get that number of participants. Yeah, you use this G Power software with such effect size. Yeah, so yep, that would be for description of whom or what you studied. Yeah, and for point 3, yeah, describe all the methods used to measure all the major parameters or outcomes recorded in your study. Yeah, and you may include some relevant subsections. For example, let's say, yeah, you administer 4 questionnaires. In this case, you might want to have 4 different subsections in order to describe those 4 questionnaires. If you use blood tests, yeah, you might want to have another section, yeah, subsection on how do you get to this blood test. If you are using maybe some imaging techniques, yeah, you might want to explain, yeah, what are the imaging techniques that you use. Yeah, so that's where you have your relevant subsections. Of course, yeah, you need to have that, yeah, informed, yeah, that under this method section, yeah, you have obtained, yeah, the ethics committee approval. And if possible, please cite the number of ethics approval, yeah, the ethics number. And you might also want to inform, yeah, in this method section that you obtain, yeah, written informed consent, yeah, from your participants. And I believe this is much closer to you, to all of you. Yeah, in the case of randomized clinical trials, yeah, indicate that the study has been registered, yeah, with an approved clinical trial database, and if possible, cite the registration number. And if, let's say, you conduct a meta-analysis or systematic review, if you register, yeah, this systematic review, yeah, or perhaps this meta-analysis and so on and so forth, yeah, you might also need to cite, yeah, the registration number. And not to forget, yeah, you need to include, yeah, the detailed statistical analysis, what software that you use. So all of those, yeah, you need to explain clearly in that section of statistical analysis. So you might want to have that standard statements, yeah, about the presentation of the data. data, which should come first. Yeah. For example, you might want to have this quantitative, normally distributed data, yeah, that perhaps are presented as means, yeah, or standard deviation. Yeah, and you can also have later on, yeah, you can have the specific statistical approaches used, yeah, that should be listed. So basically, yeah, under point 5, yeah, what I'm trying to tell you is that you need to describe, yeah, if you have participants, you need to describe the descriptive statistics first. Yeah, the characteristics of your participants, the clinical characteristics of your participants first. Yeah, the analysis that you use, yeah, to describe, yeah, the characteristics of your participants. And next, what you need to do, yeah, this when it comes to specific statistical approaches, it refers to the inferential statistical analysis that you use. Yeah, perhaps you might want to use multiple regression analysis, yeah, in order to look at or assess or examine, yeah, predictive factors. So that's where you have your inferential statistical analysis, yeah, after that descriptive analysis. Yeah. All right, so that would be, yes, table 3, yeah, suggested list of items to be included to sum up, yeah, in the method section for retrospective and prospective studies. So for retrospective studies, yeah, you might want to include those subjects, yeah, inclusion and non-inclusion criteria, yeah, ethical considerations, yeah, primary, secondary, endpoint, yeah, statistical analysis. Yeah, same goes with the prospective study. Yeah, and for retrospective study only, yeah, you might want to have the data recorded. Yeah, sources of study data. Yeah, if you have subgroups, yeah, you might want to include, yeah, the number of subjects or samples. Yeah, but for prospective study, yeah, you need to share, yeah, in the method section on the study registration if it is randomized, yeah, RCT, yeah, sample size calculation, yeah, if you have randomization procedure, and also if you have some interventions or treatments involved. Yeah, so that will be for method section. Moving on to the next one, we have this result section. Yeah, for results section in general, yeah, you need to describe what you observe without commentary or discussion. It means that you need to avoid using those words, yeah, such as maybe interestingly, surprisingly, those words, yeah, you need to avoid. Be very direct, yeah, specific. That's it for your results sections. So what happened is that under your results section, yeah, you need to describe a result, yeah, for every method that you listed or outlined in the methods section. Yeah. So if let's say you are looking for prevalence, you need to describe what is the prevalence. Yeah. If you are looking at some predictive factors, then you need to explain what would be the predictive factors, yeah, the results, yeah. And then to make the paper easier, yeah, this is your job, yeah, to make the paper easier to follow and read, yeah, it is good practice to present the results in the same order as what you have under your methods section. Yeah, all right, so I have this example, yeah, for you to look at. Yeah, so we have this, yeah, a typical paragraph of results should always start by recalling, yeah, the type of analysis that you use, then detail the results observed, yeah, by referring to, maybe you want to share, yeah, some relevant tables or perhaps some figures, yeah, or some diagrams, possible also. Yeah, and as for the methods, yeah, the results should be presented using the past tense. Yeah, for example, I have shared with all of you, yeah, the example, yeah, we have that serum, yeah, creatinine, yeah, was correlated, yeah, with glomerular filtration rate. Yeah, so that would be an example, yeah, on what you can report under your results section. Yeah, and this is the section, yeah, in which all of us, I can say that, try to avoid, yeah, because this is the most difficult section, yeah, compared to what we have, yeah, introduction section, yeah, methods, yeah, results, yeah, this is the difficult section, I can say, yeah. So let's have a look together on what is a discussion section. So when it comes to this discussion section, yeah, you are actually trying to interpret and explain, yeah, the significance of your results, the contributions of your findings, the importance of your findings, and how they fit into, yeah, the wider picture of what has already been observed, yeah, based on existing studies or literature and reported on the same topic. Yeah. So what happened is that under this discussion section, yeah, you might want to start with a brief recap of the main findings of your study. One tip is that, yeah, you might want to use the same primary objective that you have in your introduction section and the primary endpoint in the methods. But please keep this in mind when you are trying to put the brief recap of the main findings. Make sure that you do not repeat, yeah, anything, yeah, words, yeah, or sentences, yeah, that you have under your result section. Yeah, and once you have this brief recap of your main findings, then only you can interpret your results. So when it comes to the interpretation of your results, yeah, please be very careful, yeah, when it comes to interpreting your results. So maybe, yeah, it is actually a common mistake among researchers, yeah, among writers, yeah. They have a result, and when it comes to interpreting that A result, yeah, the interpretation turns into B, something else. Yeah, it can happen. So like I have mentioned to you earlier, please be very careful, yeah, when it comes to interpreting your outcomes or your results. Yeah, I have an example here. Yeah, before I move on to the final point, yeah, under this, in this box, yeah, let's have a look together, yeah, on this particular example. So if you state in your results section, yeah, that after administration of drug X, 20, yeah, out of 25 patients experience intracranial bleeding, then it is not accurate to indicate in the discussion session, yeah, that 80% of patients who receive drug X have intracranial hemorrhage. How to settle this? If it will be more accurate, yeah, for example, yeah, you can suggest that, yeah, our results indicate that drug X may have, yeah, significant adverse effects. It sounds much better compared to what you have, yeah, on this first point, yeah, 80% of patients who receive drugs, yeah, X have intracranial hemorrhage. Yeah, and yep, the final point here, yeah, describe what other authors have reported in similar contexts in order to compare to your findings. So in this case, again, you need to read a lot of articles, definitely, yeah. So that, yeah, you'll be able to identify which articles, yeah, are actually important for you to include, yeah, in your discussion section. Yeah, so I'll share with you, yeah, what will happen, yeah, for an example, yeah, for the final point that I shared just now. Yeah, please, yeah, when it comes to this, yeah, describe what other authors have reported in similar contexts. Yeah, please do not point out weaknesses in other people's work. Yeah, reformulate, yeah, so as to present the strong points of your work. Yes, you can criticize, yeah, other people's work, yeah, but please be so-called like diplomatic, yeah, when criticizing other people's work. Yeah, I have an example, yeah, that I share over here. Now, for example, yeah, instead of asserting that Smith's study was underpowered, yeah, it is helpful to use a softer tone, yeah, and a more precautious formulation, yeah, such as, yeah, Smith's study may have been underpowered, or better yet, yeah, you might want to say that our study, yeah, had sufficient statistical power to detect what, yeah. So that would be a bit nicer way, yeah, to point out, yeah, the weaknesses of other people's work, yeah. So when it comes to this discussion section, yeah, what will happen is that, yeah, you need to answer those possible questions, yeah, that I have listed here, yeah, in the next few slides. How do your results, yeah, compare to other reports in the literature? Is it the same, yeah, or is it different? So if it is same, yeah, why is that so? If it is not, if it is different, yeah, you need to justify how it is different. So I have that point number 2, yeah, if your findings are different, do you have any plausible explanations? Yeah, you need to justify. Yeah, I always inform, yeah, my students, yeah, it is okay, yeah, to have not significant findings. As long as you are able to justify, it should be all right. Yeah, and then you can have that. Yeah, what are the possible discrepancies, yeah, in circumstances or maybe populations, yeah, or approaches that may explain why you observe what you observe in your research. Yeah, all right, and we can have those 2 points. Yeah, any particularly surprising or interesting findings, yeah, should be discussed and potential explanations put forward. Yeah, and can your findings be extrapolated to other contexts or populations? And if not, why not? It means that whether, yeah, your findings, yeah, can be generalized or not, yeah, you need to justify or explain why and why not. Yeah, all right. So that would be discussion section. Yeah, now let's have a look together, yeah, on this abstract section, right? Okay, so as you all know, yeah, this abstract is a short summary, yeah, of the article in a few sections. So basically, yeah, for your abstract, you might want to have those, yeah, background, methods, results, and conclusion. Yeah, don't worry, I will explain later in the next slide. Yeah, what is it that you need to include, yeah, under those 4 components. Yeah, and for this abstract, yeah, you need to use, yeah, it is being used, yeah, in order, it can be used, yeah, for referencing purposes in online bibliographic databases. So basically, again, yeah, this abstract, yeah, is very important, yeah, similar like what you have for your introduction section. Again, you are trying to sell your work, all right? So when you submit, yeah, your work to a journal, most of the time the editor will always read, yeah, your abstract first. Yeah, so if your abstract is not that good, yeah, they will right away reject your work. Yeah, so please, yeah, design or write your abstract carefully. So what is abstract in detail? It is an independent unit that is comprehensible as a standalone text without, yeah, the readers need to refer to the full text. So it means that once they read this abstract, they will say that, hey, that abstract is, this study is what I would like to look at. Yeah. So the next point is that, yeah, it's also usually the first item I have mentioned to you. The first item that a potential reviewer will see when being invited to review your paper for publication in a journal. Not only potential reviewer, but at the same time, the editor, before they send out your work to this potential reviewer. Yeah. All right. So what are the main points that you need to include, when you write your abstract? So you can have those components. Yeah, you need to have your background. You need to have your methods, results, as well as conclusion. Be very specific. Yeah. Most of the time, scientific journals out there will tell you the number of words, that you need to fulfill, you need to follow for this abstract. Sometimes, from 200 to perhaps 300 words, for this abstract. So you need to choose your words, wisely, because you have this limited number of words, So for background, you need to have a brief reminder of the context as well as a brief statement of the main objective. So perhaps, under this background, you might want to introduce what has been done in one sentence and what would be, the main objective that you are, why you conduct, such research. And yep, I have mentioned to you just now, it should be short and to the point. Yeah, it can be 2 to 3 sentences for this background, and then you need to also include, don't forget, mention, the gap in knowledge that you hope to fill. That will be for your background section, and then for method section, you might want to start with describing your participants. Maybe you might want to define your study groups if you have. Maybe you want to describe the main interventions or treatments, maybe the tools, the questionnaires that you use, and finally state the primary endpoint and secondary endpoint, for this method section. And then moving on to the results, you need to list, the main results, perhaps with means, standard deviations, the p-values, odd ratios, and so forth. And then again, you need to list the result, of the primary endpoint first, or the primary outcomes first, and followed by the secondary outcomes. And maybe, if you have extra words, you might also want to provide a result for every method you mention in the methods section. And finally, you need to have your conclusion. Now, for this conclusion, you need to have a one-line conclusion summarizing your main findings. And if you have extra words, you might want to have one sentence, describing the implications or suggestions for future research, possible as well. And those three, section, references, discussion, and also we have item for figure, tables, diagrams, or illustrations, all of which you do not need to include in your abstract. No references, again, no discussion, no figures, tables, diagrams, illustrations, and so forth. All right. And we also have this title, right? What you need to have, when you are coming up, with the title. I know, I came across, some bombastic titles, of research, but at the end of the day, it does not portray, what you those researchers, would like to share. It's just like it's there, and to be honest, it is you are trying to attract people, to read your work, but when you have such a bombastic, different titles, people might want to, to me, I might want to skip, that article, because to me it's like, I want to see it something which is direct, or close to what I am looking at. So basically for title, you should it should contain keywords, in order to reflect the main issues in your article. It must contain the principal terms and keywords. This is very important so that people out there, when they want to search, yeah, for the key terms, yeah, the keywords, yeah, they can easily, yeah, look for those, yeah, in PubMed or Medline, and they will be able to get to your articles. Yeah. So when it comes to the title, yeah, we have some main elements that to be in which you need to include in your title. So you might want to have main factors studied. Yeah, perhaps if you are examining the effectiveness of a particular drug or intervention, perhaps you might want to state the name, yeah, of the drug or intervention. Yeah, you might want to include the population or the clinical population or the clinical context that you are looking at. You might need to spell it out in your title. And then when it comes to design, yeah, is it a randomized clinical trial? Is it a double blind? Yeah, it is very important for you to put it there in your title. Yeah, and then we have this, yeah, main finding. Yeah, what is it? Yeah, that you are trying to share, yeah, with the readers out there. Yeah, by just looking at the title of your work. Yeah, and then put the most important aspect first. So if the focus is on the intervention, because this is what distinguishes your article from others, then always start the title with intervention name. Yeah, and of course, yeah, avoid imprecise formulations, yep, that serve no specific purpose. For example, avoid terms such as a report of or the effects of. If there are effects, state what they are. Don't leave it just like that. So that would be for your title. Yeah. All right. When it comes to these references, yeah, I cannot say that you need to follow, hey, you need to follow this APA format of references. Yeah, you need to follow this B style of references. It depends very much, yeah, on the format of the journal, referencing format of that particular journal that you intend to submit your work to. So, but in general, yeah, for references, I believe you know, yeah, list all the sources you have used. Yeah, all right. And when it comes to these references, you know, young researchers, especially like me, like all of you, yeah, any idea or fact, yeah, that emanates from another source other than yourself needs to be supported by a reference. Yeah, you need to have a reference, right? But when it comes to this universal truth or facts that are widely established, then you do not need any references. For example, the one in the bracket, yeah, cardiovascular disease is very common. You don't need any references for that. Yeah, or ideas or more particularly phrases or names that were coined by someone else do need to be referenced. Yeah, so that's how it works for references. And before we end, yeah, that will be the take-home message. Yeah, let's recall together what we have looked at just now. Yeah, we have this title. So make sure, yeah, you cite, yeah, properly, yeah, the drug that you use, or maybe the intervention that you use, yeah, the context, the design. If it is RCT, mention it, yeah, and then make sure you explain or not explain, yeah, put it there in your title, the main finding, whether it increased, decreased, and so forth. When it comes to abstract, yeah, in general, yeah, we have those 4 sections. We have introduction, methods, results, and conclusion. So it should be comprehensible by itself. Like I've mentioned to you just now, I've mentioned to you guys again, yeah, please, yeah, this abstract, yeah, you have very limited number of words. So choose your words wisely. Yeah, all right. So that is for abstract. And always remember that you are trying to sell, yeah, your work. Yeah, and then we have this introduction section. Yeah, explain the current state of knowledge. You need to have your references. You need to have, yeah, or describe or identify, yeah, the gap in knowledge that you aim, or you wish to fulfill, in your study. And finally, you need to have your objectives. That's where you need to also include, your hypothesis. And then we have this method section. Describe in detail what you did and how. Detail the selection criteria, inclusion, exclusion criteria of your participants. Describe all tests, questionnaires, interventions, and so on and so forth. Detail endpoints. You can have your primary and secondary outcomes. And then you need to have your ethical considerations. It is where you also need to include this informed consent. Explain that. And also the procedures of how you are going to collect your data, right? And also the statistical analysis that you are going to use. This statistical analysis, don't forget, apart from describing the descriptive and inferential statistics, don't forget to mention the softwares that you are going to use in order to analyze your data. And when it comes to this results section, describe your study results, avoid commentary and interpretations. I've mentioned to you just now, avoid those words, surprisingly, and so forth. Give a result for every method presented in your methods section, and whenever possible, use appropriate illustrations. It can be tables, it can be figures, and so forth. And for discussion, I know this is a very difficult one. Sounds easy, but it is very difficult. Start with a recap of your main finding. Put your results in perspective with other reports in the literature. So it means that you need to have existing studies, past literature, past studies that might support your findings, that might support or might not support also your findings. Explain the significance of your results, and how they contribute to the overall state of knowledge. You need to also describe the strengths and limitations of your study. And I have seen in some journals, they added another two subsections, clinical implications and research implications. You might want to have that, depending on where you are going to submit your paper. And of course, everywhere you go, you need this, references, list all sources used as a basis for your work, and please check the accuracy of all references. And with that, we are done. And before we end, I'd like to share with all of you, on how to, what we call that, know which journal, that you can submit, your paper to. I always advise my student, because you do not have that abstract yet. What will happen is that I always inform them that perhaps you might want to check the articles that are the articles that you refer, that are similar to your study, and look at where those articles being submitted. That's one way. And another way is that if, let's say, you already have your abstract, or perhaps you already have your titles, you can always find the best journal by using this journal finder. You can have this under Elsevier. I checked. We have this Wiley. Springerling, they also have that. You just key in the title, you just put there your abstract. We also have this Taylor and Francis, where you can check where you can submit your work, your paper to. Sage as well. So basically, most publishers have this what do you call that, place where you can insert your title or your abstract, and they will be able to suggest the journals where you can submit your work to. Yeah, so with that, yeah, we are done, yeah, with this topic, yeah, on a student's guide drafting a manuscript. Yeah, all right, let me stop sharing.
Thank you,
Okay,
Teacher Rifa.
yep.
And thank you for that very excellent presentation. I love there is a lot of examples, like notes, so
Yeah.
that very
Mm-hmm.
useful for those who are very new in
Mm-hmm.
preparing manuscript.
Mm.
And if I'm not mistaken, for master in neurosurgery, they need to publish to get
Mm-hmm.
fast. So maybe
Mm-hmm.
you have some tips for that.
Mm. Mm.
What need to be considered for us to get published first,
Right,
in
right.
order to pass?
In order to pass, I believe that for this Department of Surgery, yeah, under this Faculty of Medicine, you need to publish your work under Web of Science, correct? Yeah. So basically, yeah, first of all, yeah, what will happen is that, okay, okay, I'm not sure how many uh, articles that you need to publish. But if let's say for PhD, you need two. So if you need the two, yeah, please start at the very beginning. Yeah, the simple way to get things done is to go for review paper. So review
Oh,
papers should be one way on how to go about this. Yeah, because you do not have your data. Because you do not have your data, then while I mean like collecting your data, it would be best if you can go for review papers. There are quite a number of review papers out there. Yeah. You might want to go for scoping review. You don't need to go for meta-analysis, Cochrane systematic review. I know that's a very difficult. Yeah, but you might want to go for, yeah, like I've mentioned, yeah, just a simple one would do. Yeah, then once you have, yeah, your data, then you can go for, I mean, like publish, yeah, your work. And just want to share, back when I did my PhD, yeah, I submitted my work, yeah, a paper at this journal, Supportive Care in Cancer.
mm.
Very high H index. I believe you submitted your work before also, Dr. Hamiza, over there at Supportive Care in Cancer. Yeah,
Family cancer, yeah.
yeah. All right. So I submitted in that particular journal, and it was without correction.
Oh, how long
Yes.
it takes?
Yeah, it is without correction. It is possible. You see, I did only a cross-sectional research study. It is possible. How I did it? This is what I'm going to share. Yeah, you need to have at least one article which is close to your study. In my case, it happened that Prof. Aisha did submit her work at a supportive care in cancer. Yeah. So, and that study, yeah, is similar, more or less similar to my study. So what happened is that I followed, yeah, I followed
Mm.
all the, I mean, the style of
Style of
writings,
writing,
things like that.
mm.
So that's my suggestions. And yes, it's there. It's, I mean, like, yeah, of course, you might say
Yeah.
that cross-sectional study is just a simple one, right? And yeah,
So
but if you
it
follow,
actually need a strategy lah, how
yes,
to get published
yes,
very fast lah.
yes, yes. And the thing is that another way is that yeah, English is not my language, yeah, but I spend money for proofreading. That's very important. Recently, I received an article from a reputable journal requesting me to review the work. Yeah, and then when I look at the work, yeah, it seems to me that these authors did not submit their work, yeah, to proof any proofreaders. So please, whenever possible, yeah, it helps actually, yeah, for you. I mean, like, yeah, the content is there. First of all, you need to get your content right. Yeah, content must be accurate. Then only you go and ask for help, yeah, the proofreader to assist you, yeah, in making things smooth. yeah, so that when people read, it is very smooth. Yeah, the flow is there. It helps a lot. So that's yeah, my tip. Yeah, tips for all of you who would like to publish. Yeah, as I mean, like students. Yeah, you need to get things done easily.